So it is bedside report time, and we get a client who's a G3 P2, and she is 39 weeks. She's contracting every 5 minutes, and it is our job to figure out, is this the real deal or is this false labor? What should you assess to determine if this is true labor or false labor? We want to look at two things, and that's going to be contraction frequency and any cervical changes. And the NCLEX loves to test on this distinction. In false labor, uterine contractions are going to be irregular. They're known as Braxton Hicks. These contractions will stop with rest and hydration. In true labor, our contractions are regular, like every 5 minutes, and they're going to intensify with time and activity, and nothing you do are going to make these go away. Now for that cervix. In false labor, we're going to see no cervical changes, no effacement, and no dilation. But in true labor, we're going to have progressive changes that are going to lead to dilation and our cervical effacement. I want you to think of that cervix like a donut. That hole in the center of the donut is going to get wider, and that's dilation. And that donut is going to get thinner and flatter, and that's effacement. If we've assessed this client and we've determined that she is not in true labor, then what exactly is happening? Well, she's probably just having Braxton Hicks contractions. Remember, those contractions are irregular, and it's just the body's way of getting ready for labor. So there's many signs that precede labor, and Braxton Hicks is one of them. Another one is going to be lightening or dropping. This is when that fetal head drops lower into the pelvis, and that's just to get ready for labor. So you might see this described on the NCLEX as the client can suddenly breathe a little easier, and that's because that fetal weight is not pushing up on that diaphragm anymore. However, she might be having increased urinary frequency, and that's because that fetal head is pushing down on that bladder. You might see increased vaginal discharge, and that's just increased mucus production that's happening as that cervix is starting to soften. Now, this might get described as bloody show, and that is a pinkish brown tinged bloody discharge that happens. And don't panic. This is normal pregnancy bleeding that happens at the end as that cervix starts to soften and thin or efface. And our last sign preceding labor is going to be this energy burst, or also called nesting. This is when the client gets a sudden burst of energy and she wants to clean her entire house. She is preparing for that baby's arrival. Now remember, none of these signs mean it's time for her to run and head to the hospital. It just means her body's getting ready and that baby's getting ready.